I've just given you 1 or 2 slides on this. Methods of connecting with visual people, auditory people, and kinesthetic people. When you understand that your opponent is a visual person, they'll give much more their own selves. They're dressing like they want all diagrammatic representations. They'll be, when you open a book, when you are more interested in the verbal content, you're an auditory person. When you see a picture and when you don't even want to go through the verbal content there, you see the picture, you get the idea of it, you'll be able to remember it forever, like students especially, they are visual people. When you are really attracted to the diagram there, you're a visual person. And when you are attracted to the paragraph or the thing written there, then that is your auditory person. Okay, but when you really want to try that experiment, do, and then only you'll be convinced, then you're a kinesthetic person. And the way we connect is use visual words like see, obvious, transparent, it's clear, and all such words, relate to how opaque or like transparent it is. And use diagrammatic representations to see help the person see the outcome. Auditory people use auditory words, talk to them a lot, explain, answer the questions, show written material, make phone calls. Kinesthetic people use kinesthetic words, make them feel the situation, make them touch and feel the product, take them into your. Okay. So that is all about understanding yourself and others. I'll summarize this part. So all of us speak different regional languages. We have different, mother tongue. And the language that we speak using our mouth is a verbal language, is different from area to area. But all across, across the world, all over the world, people have only 3 languages. It could be in Australia or Germany or the US or in India. It is either visual, auditory, or kinesthetic. So, in your house as well, you have people talking these languages. You, your house, your spouse, your children, your parents, your siblings, all of us talk different languages, and therefore we have controversies because of not understanding what they want, what not understanding, like why you're able to not able to make them understand you. That is because their brain language is different. They see things in a different perspective. For example, people joining the gym. Okay, one can go to look better, to look slimmer, to reduce weight and fit in clothes that they like and to look beautiful or young. Okay, one will want to hear compliments in office and one will want to be healthy inside. Okay, they lose weight not to look good, but to feel good. So that is the kinesthetic part. To look good is a visual part. And to some people, more than looking good, they want appreciation from all of the others. Okay, that's the auditory people. So we all have different intentions of as simple as going to a gym. What about our life? So same thing applies to all the places, your workplace, your department, your seniors, your juniors, your students especially. So you'll be amazed like why they're not understanding you in spite of you shouting so much. Okay, instead of you shouting, if you are able to adapt to what they are like, how their brain works, it'll be easier. This is on an individual note. And when you understand, when you are like addressing a bigger crowd, there are certain techniques as to how you can make them listen to you, instantly get in alignment with you, instantly respond to you in a better way. There are certain techniques which will require more time to analyze and to teach you all as to how to bring the crowd under your control, how to make somebody listen to you when you talk over, how to make somebody be receptive and to understand you and to be to be more productive when they sit and talk in front of you. All these we have a lot of techniques, simple, very simple techniques, out of which I have taken just one today, how to build a better rapport with others. Okay, first thing is the way you sit. Assuming that each one of you is sitting in front of me, you are looking at me, your chair is facing me. And if I'm going to tilt my chair to the other side and put my hands on my cheeks, and if I'm going to look that side with my ear to you, and then I say, yeah, continue, continue. And in between when you're talking, if I'm going to take the phone and just check my messages then and there, how will you feel? Yes, that's right, disconnected, disinterested. Yes, you're right. So, very first point to build a unconscious rapport with them, apart from eye contact, greeting, shaking hands, apart from all of those, body language things, unconsciously, if you have to be connected with them, just mimic them, aim them, sit in the way how they are sitting. Look at the first picture. Sit like just how they are sitting. Like if they are sitting like this, you can mirror them. Body mirroring, it is called. Body mirroring and matching. If they are sitting like this, you also can sit like this. If they are leaning forward, yes, you also can lean forward. If they are like, nodding their head frequently, yeah, you also can do that. So what happens here is instantly there will be a unconscious rapport for. Okay, their subconscious will start trusting you. If they are like ha ha ha, they are laughing in between, you also do the same thing. So what happens, there'll be a beautiful bonding between the two, and there'll be a beautiful understanding between the two. You'll be more receptive, they will be more receptive to you. They will instantly buy whatever you say, and then the bond is created there. This we call as pacing and leading, where when we start modeling what the other person does in front of them without them knowing. Okay, if you're going to like be very consciously doing like this, changing your behavior then and there, they'll like get angry. I mean, they'll instantly become very aggressive. What are you playing? What are you teasing me? What are you like doing mimicry or what? They may like become very angry there. So without the other person knowing, I know like all of you are very good in Googling, so kindly go and Google about all these things. You'll have a lot of info on that in the internet, pacing and leading and building unconscious rapport, and match their body language, volume, tone, and word and phrases. Assuming you're an important deal with somebody, you want the deal to be productive and you want it to be a hit, and the other person there, he uses the word okay frequently, then you also can use it without him knowing consciously. You also can say, okay, I get it. So both of you will be repeating the same words in the same tone in the same volume. That's an unconscious rapport to build. So with some people, you get the instant connect. Instant networking is done. And whatever you guys decide or do will be a hit. And you would say, like, I don't know why I liked him at the first sight. When I saw you first itself, like you are like my wavelength, my vibe. I instantly liked you, connected with you, and I became friends with you. I wanted to sit next to you. All that is because of this unconscious. You enter a room, there are 10 people in different chairs, 10 chairs are empty, but then you feel attracted towards one person and you go and sit along with them because of this unconscious rapport between you and him. Okay, then you'll say, like, I came into the room, yeah, I saw everybody, like, I liked you, and that's why I came and sat with you. And that's because of not any random reason, it's because of that unconscious rapport. You feel comfortable and good with them because something was working there. So this we can do it like voluntarily as well. That is involuntary. This is like voluntarily, like you can, make a person like you, make a person fall for you, make a person connect with you instantly, make a person like the other person might end up saying like, I came in with a totally different idea. I never wanted to do this, but I don't know why after talking to you, like I totally changed my mind. I agree to whatever you said. That is because you influence the other person to be receptive to you and to change his mind and to agree to whatever you say. So, being teachers, you can very well make your students listen to whatever you say. You can be the piper there, and all of your students could be the rats there. They're following you. You could because they are mesmerized. We see this, isn't it, in our workplace? Many students they'll fall like for certain teachers, not knowing why they'll have a big fan following crowd. Certain teachers, they'll have a big fan following crowd because of this beautiful connection the group of. Okay, and on demand, we can also build this connection with the students, make them like us, make them, form a club, fan club for us, and do whatever we say. Of course, we are going to say only good things for them, for their development. And there is a particular technique of putting all these things that is called as this unconscious stuff. Okay, so I'm just giving you the gist of it. And Yes, we have last 15 minutes, so I quickly give you a gist about what this is. This is anchoring. The ships are anchored because they don't drift away into the sea. Just like that, when we are in a super high position, say assuming we are getting an award on the stage, it's a beautiful moment there, and we feel super high emotionally. That feeling of sense of achievement, fulfillment, that gratefulness, and everything. What if we are able to anchor this state of mind all the time or on demand? On demand is like when you are put through a challenge, very difficult situation. You're feeling very vulnerable there. At that point, if we are able to put you into the state of receiving an award in the stage, if we are able to combine, collapse these two states of mind, how nice it would be for you to feel great and positive and powerful in a place where you are vulnerable. And that's exactly called the anchoring technique in NLP, where we can anchor people visually, auditory, and kinesthetically. To tell you in a small way, like the same example, when a person is receiving a gift of the prize on the stage, has been awarded your the day you get your PhD doctorate there, and when you come back and when you think about it, you kinesthetically anchor yourselves of that feeling. And the next stage, you're going for an interview, assuming an interview or for some other presentation. On the spot, when you go there and you think you're going to receive the same doctorate award, and you are there to receive the award, and you collapse these two states of mind, you're going to feel super. The positive will take over the negative, and you will feel very great that day. Okay, this is called as anchoring. There are many types of anchoring that we can do. All these are tools in NLP. They're not techniques, they're not patterns as we call them, they're not therapies. These are simple tools that we can work on ourselves and we can use it in therapies as well. So, types of anchoring that we can do is again the five sense organs: kinesthetic, auditory, visual, olfactory, and gustatory. So, I'm going to quickly, take you through these. So, can you all just close your eyes? I request all of you to close your eyes. And kindly, can you recall your childhood friend's voice? So, a friend from your school days or your college days, close your eyes and just try to hear their voice. And now imagine the sound of a dinosaur from under the water. I know you wouldn't have heard it. It's okay. Imagine it with your eyes closed. I'm doing it simultaneously. And now touch a rose. Just feel it. The eyes closed, just touch a rose. Give yourselves a diet tip to follow. First year classroom. Now see yourself 10 years older from now. Visualize yourself. What color dress are you wearing? Now open your eyes. So, each one of those, your eyeballs would have gone to different directions. So, when you visually remember something, your college first year classroom, okay, your eyeball would have gone to your left top corner. And when you auditory remember your friend's voice, your eyeball would have gone to the middle part. And your internal, give yourselves a diet tip. Okay, it goes down. If you keep your eyes open and you think about all these things, this you can work later with your friend again. You can ask them questions and watch as to which direction their eyeballs are moving. It goes to the bottommost left corner. And when I ask you to look at yourselves 10 years ahead from now, it goes to the top right corner. It would have, or it should be, it would have gone to your top right. An auditory construct, dinosaur from 10 feet below the water, auditory middle segment, and the feeling of touching a rose. It goes to the bottommost right corner. So this activity is called eye accessing cues. So when I go to my work and then come back in the evening, and when I may ask my daughter, like, did you study all the day? And she says yes. And in that moment, with her eyeball going to the right or the left, I can easily understand whether she's telling me the truth or not. If her eyeballs go to the left for a second and come back, I mean, that's like she's recalling from her memory. And if her eyeballs move to the right and come back, she's creating, constructing an answer there. So you can learn more about this. It is very, very interesting. So coming to the last slide, I was talking to you about tools and techniques and therapies, isn't it? Where in NLP we use all of this based on human psychology, and then we can bring in beautiful positive changes that as and how you want. Okay, addressing to all those that's bothering within us physically, emotionally, mentally, and we can uproot it and throw off everything in just conversational programming in within an hour, or if required in 2 hours, like however. And some of those techniques are giving you the name swish pattern, reframing, healer within, and these are the other techniques: collapse anchoring, regression, circle of excellence, timeline therapy, and there are much more. Okay, there are a set of tools like around 50, and there are hundreds of therapies which we can combine. We can create our own therapies using these as the base and address to the client needs, give him relief from whatever's been bothering you, change his state of mind, and then make him achieve whatever he wants. And so far, like, so many people keep coming to my centers, like people who work, students majority, women who want emotional freedom, like they want to feel better, many housewives who want to get into profession, people who have loans, people who have emotional baggage. They all come here, cleanse themselves, get rid of all the things that have been worrying us. And NLP is one beautiful brain science, which is like God's gift to humanity. And only after my life changed, I got the 100% confidence in this, and post which there was no turning back, no looking back. I'm not the person who I was like 10 years back. I'm improving myself every single day, every single moment. I'm able to understand people. I'm able to understand myself. I'm able to cater to the needs of other people. And that, I think, is my ikigai for this life. So having said this, thank you very much. We'll get back to the question and answer round.
Hello, ma'am.
Yes.
Madam, can
Yes,
you please show the PPT of the visual, auditory, and kinesthetic?
Yes. Like the session was up till 12:30. Is it okay if it is getting late for you all?
No
I
problem,
really
ma'am.
don't mind. Okay, I'll show you one second. Are you able to see the screen?
Yeah, madam. Just I wanted to know VAK and other two
Yeah, I'll show
initial
you.
letters. Yeah, yeah.
Yeah. This one is it?
Yes,
This one
ma'am.
is it?
Yes, ma'am.
Oh,
Yeah,
okay,
yeah.
no problem.
Previous one. Previous one.
This one? Visual, auditory, and kinesthetic?
Yes, ma'am.
Is it? Oh, okay. So in the meanwhile, others, one by one, you can ask me any question if you have.
जिनको क्वेरी है वो हैंड रेस करिए. श्री लक्ष्मी
Ma'am, can
मैडम,
I
एनी
have a
क्वेश्चन?
presentation?
I just wanted to know about the meaning of O and G in the PPT slide. What you should.
Von Grinder, I mean, the founders of NLP, is it?
Yeah, yeah. VAK. V is for visual.
Visual,
A
A is
auditory.
for auditory, K is for kinesthetic, O is for olfactory, and G is for gustate.
Okay, madam. Okay.
Yes, ma'am. Sarita, ma'am. Yes, ma'am.
Yes, I have a question for you. Do you have this NLP center in Hyderabad? Do you have an NLP center in Hyderabad?
Yeah, people, the NLP practitioners are there all over the world, ma'am. And we can do it online also. Like I have my clients from all over the world.
Okay.
So we can do all these therapies online as well.
Okay, ma'am. Thank you.
Okay. So all other doubts, I'm ready to handle your doubts.
Anybody else?
Preeti Shahu ma'am, thank you very much.
Ma'am, good afternoon, ma'am. I am Uday Suryan from Viluppuram district, Tamil Nadu.
Great. Uday Suryan, good afternoon, sir.
Yes, good afternoon, ma'am. Ma'am, actually, I am very much interested in learning psychology. Actually, I am working as an assistant professor in physics department.
Okay.
If I want to switch over as a counselor, students counselor like that, where I want to start, where I can start my career in that counseling
Yeah, you can
course.
start doing psychology courses like counseling psychology, clinical psychology. Like you can start doing a psychology course parallelly along with your work and other degrees. And then
Okay.
you can do NLP, CBT courses. Cognitive behavior therapy is another psychotherapy, another neuroscience where you will be able to address to the feelings and emotions of people and the behavioral pattern as well. So
Okay.
please start with some psychology diploma or a degree, however you're comfortable, and then move on with learning CBT, learning NLP, and all the other psychodynamics and psychotherapy courses. There are many.
Okay, ma'am. Actually, in Annamalai University, they are providing MSc Applied Psychology.
Uh-huh. Okay.
Can I do that course, ma'am?
Yes, sir, very much. Very much. Start with the basics.
Okay.
Start with the basics. Directly do not go to MSc Applied Psychology. Do the BSc one. Start with the basics
BSc
and then
actually that
gradually.
okay for UG there is no distance mode of education. I think so. Is
Okay.
there any
So
possibilities,
in
ma'am?
that case, you can apply for applied psychology. And in the meanwhile, there are so many certificate programs for psychology, diploma in psychology, counseling psychology, and all. You can do that for better understanding of the subject.
Okay, ma'am. But you can share your mail ID, ma'am. I will contact through mail also, ma'am, regarding this.
Okay, sir. Yeah. I'll just type it in the chat window.
Okay, ma'am. Thank you, ma'am. Thank you.
Okay.
Yes. Anyone else? Yeah. Anyone else? Madam, it was an excellent session, madam.
Ma'am,
Thank you very much.
hello,
Yes.
hello.
Yes,
Yes,
sir.
please.
Yes, keep going.
Ma'am, somewhere I have heard about butterfly effect. Can you explain it in short, ma'am?
A butterfly effect.
Yes, ma'am.
Okay, it's that adrenal effect in your tummy. Like certain moments. Did I send my ID?
Yes, madam.
I typed it. I think I sent it right. Okay, so when there is that fear energy, always like we will be when put under challenge, will be either in flight or fight mode or freeze mode. Okay, when we undergo the fight modus, like when we get into action, when we quarrel or talk back or over explain or under explain, all those things comes under fight mode. Flight is you escape the situation. You're not ready to face the situation, so you avoid the situation on the whole. You absent yourselves there, or you don't talk, or you run away from the scene. Freezes, you become so numb to that particular challenge that you will not be able to express at all. You do not know what to do. Freeze mode is you are stuck there. You do not know how to move forward or come out of the situation. So in the first two segments, fight or flight, there'll be so many chemical reactions in your body when you are put under stress there. And therefore, what happens is there'll be the churning and churning in your stomach. That feeling we call is a butterfly feeling. Okay, when you stand in a interview and when you meet your life partner for the first time, there'll be all butterflies inside, making you feel very uncomfortable, right from the stomach, from the chest area. That is all because of two things. One is your chakras. If you know about your chakra alignment, the 7 chakras in your body, when there is a misalignment in your chakras, you tend to have this butterfly effect, wherein the churning and the crumbling feeling inside your chest and the tummy. Another one is when you have too much of hormone secretions in your tummy or in your chest area, where you're not able to have a balance in the hormones there because of excessive fear energy or excessive some other kind of unresourceful state of mind, then you go through this feeling.
Okay, thank you, ma'am.
Thank you.
Ma'am, again, I am Uday Suryan. Can you briefly explain about brain and mind, ma'am? Actually, as I read from certain books, they are different. But
So
you're
the
saying
brain
brain
is
and
the
mind are the same.
anatomy part, the physical component of the body, just like our hands, our fingers. Brain is just a physical part. What psychologists and American Psychiatrists Association say is that there is a small slit in between the front and the back side of the brain, isn't it? They say that the subconscious mind is present there, where two halves of the brain meet. And inside the brain, there are a lot of neurons, billions and trillions of neurons. So, assuming a neuron is like this, these are like finger-like structures called the dendrites. Assuming a neuron is like this, where the center there is a nucleus, and all these are long projections like the branches of the trees. When two neurons, there are billions and trillions of neurons in the brain, and just mere simple two neurons, when they meet, at the intersection of these two dendrites of two neurons is our memories and our feelings and everything. You know, and they say that the subconscious mind is present between the two halves of the brain. In the intersection points, in the pit, in the deep valley, our subconscious mind operates. And this anatomical part of the gray matter substance, different regions are responsible for different actions. Like one broad region will be, responsible for thinking and planning and comprehending. Another one small area will be in charge of emotions and feelings. It's called as a limbic brain. Okay, and another small part will be for hearing. So the entire brain is not for hearing. One small region of the brain is responsible for our hearing. One small brain part is responsible for the smelling. You know, that particular input. One and yet another, a different component or a small part of the brain is responsible for vision. But the thinking and planning happens in some other area. And all these feelings are relating to some other small emotional, I do have that slide, but maybe in another session, like I can show you all those slides. Okay, it's responsible for emotions. And there is something called as amygdala. It is not even in the brain, it is beneath the brain. Assuming this is the brain, amygdala is also called as brain hijacker or kidnapper. It is present below the brain, two small green color structures in the backside of the neck. They are also called as brain hijackers or kidnappers. Once, when you are emotionally being triggered. So, people, who commit murders, okay, who say lies and all, they are like acting under the influence of amygdala. And then later they'll be repenting, like, oh my God, why did I yell at somebody? Why did I shout? Why did I hurt her? Why did I commit this grave mistake of murdering somebody or, telling lies or killing a person or whatever it is? Okay, because when we are emotionally triggered off, okay, I'm just answering to the same question now. When we are emotionally triggered off, your feelings and all are put into action there, your brain stops working. Then this small part of amygdala, it takes in charge. Okay, you can browse more about this brain hijacker or brain kidnapper, amygdala. And when you work under the influence of your amygdala, you tend to take a lot of wrong decisions, wrong actions. And once when you are like emotionally stable, that goes back to its own place and your brain starts working again. And then you repent for whatever you said or did there. That's your common brain working. And now this mind is something related to your feelings. Okay, your subconscious mind, where you store a lot of memories from your past, from your birth, is in between the two halves of the brain. Whereas your memories are stored in between the dendrites. It's like a huge ocean for us to go through, study, and understand. And your emotional decisions, out of like a spurge, you take some random decisions, you shout at somebody, or you do something which you shouldn't be doing. You take a decision which you shouldn't be taking, an impulsive decision. It could be like as simple as you have only 5,000, but you see a dress worth 6,000. You don't even think about anything. You scrap in all your money and buy the dress, and then later feel bad about it. Why did I put so much of investment in that particular asset or dress, or why did I even invest myself into this relationship? It's all because of your amygdala. Complex question. It's a complex thing to understand because there are so many things here. Not only the physical part, but also the emotions and the feelings and the memories involved in it. Yes.
Thank you,
Did
ma'am.
I
Thank you
answer
very
your
much.
question? Okay. Next question.
Anyone else? Otherwise, madam is having another session with us tomorrow also. So,
A
shall
similar
we?
topic. Tomorrow
Yeah.
is also like an extension of
Yes,
this.
yes, extension of this. So, यहाँ पे हम रुकते हैं, madam. Shall we stop here? Yeah.
Yes, ma'am.
Yeah.
As you please.
So I extend my sincere thanks to respected Pushpa madam once again for engaging excellent session for all of us. It was very much related to ourselves, hence it was very much engaging also. So thank you so much, madam, once again for accepting our invitation and engaging a wonderful session for all the participants. See you tomorrow, madam, on the same time. Thank you so much, ma'am.
Thank you very much, ma'am.
Thank you. Have a
Yes,
great
bye.
day, ma'am. Thank you.
You too. Thank you. Bye.
Thank you very much, ma'am.
Thank you, ma'am.
Thank
Thank you,
you.
madam.
Thank you, everyone. You please proceed for your lunch break. We will meet at 1:30 for our next session. I'll start the meeting at 1:15. हम 1:15 को मिलते हैं. 1:30 अपना नेक्स्ट सेशन शुरू होगा. आप अभी लंच ब्रेक के लिए प्रोसीड कर सकते हैं. थैंक यू सो मच एवरीवन.